Okay, so picture this. Your dog is out in the backyard having literally the absolute time of their life. You know the scene. Sun's shining, tail is wagging a mile a minute, and they're enthusiastically investigating some patch of flowers. But then, out of nowhere, they yelp, jump back, and just start pawing frantically at their snout. Yep, they've just met an unseen bug. Welcome to today's Explainer. We're going to walk through the Canine Guide to Insect Bites and Stings, making absolutely sure you know exactly how to handle these, unexpected little outdoor encounters. So let's dive right into this, because this is usually the very first question every pet parent asks. Is that just a random passing itch, or did they actually get bitten by something? I mean, dogs naturally explore the world mouth and nose first, right? So their face and their paws are prime targets for curious insects. And since our dogs can't, just use words to tell us what happened, they communicate pain or irritation through subtle, and sometimes actually really not so subtle, behavior changes. So our job? We've got to learn how to read those signs accurately and quickly.
To do that, today's triage and treat journey is going to cover 4 main steps. First, spotting bites and stings. Then, safe at-home relief. Third, recognizing emergencies. And finally, preventing future encounters.
All right, let's kick things off with Section 1, spotting bites and stings.
Now, the tricky part about bugs is that, you're not always going to witness the actual sting happen. You might just be sitting there on the porch and suddenly notice your normally super calm dog becomes unusually restless, or maybe they become unexpectedly vocal, just whining out of totally nowhere. Or, they get completely fixated on one specific spot on their paw or their flank. That sudden behavioral shift, that is your first major clue that a bug bite could be the culprit.
If you do catch that behavior shift, you've got to look closely at your pet for physical symptoms. So, what are we looking for? Localized redness and swelling? Or skin near the bite that actually feels unusually warm, even hot to the touch. You might also spot hives or raised bumps kind of spreading outward. If you combine those physical signs with the excessive scratching, obsessive licking of that one area, or the whining we just talked about, you can be fairly certain your dog has definitely crossed paths with a bug.
Which brings us to Section 2, safe at-home relief. Okay, so if you actually locate a stinger embedded in their skin, your very first human instinct is probably going to be to grab a pair of tweezers. Do not do it. Seriously, squeezing that stinger with tweezers actually acts like a tiny syringe, and it just releases more venom directly into your dog's skin. Instead, here's what you do. Grab a rigid object, something like a credit card, right out of your wallet, and just gently scrape the stinger away. It's a super simple mechanical swap that is going to save your pup a lot of extra pain.
All right, so with the stinger out, it's time for some ongoing relief. Highly effective, completely safe home remedies include applying a cold compress in short intervals or mixing up a really simple baking soda and water paste to soothe the sting. You can even use pet-safe aloe vera gel. And hey, if they've got multiple bites, an oatmeal bath works wonders to calm widespread itchy skin. But listen, whatever you do, avoid dangerous human medications. I know it is so tempting to reach for over-the-counter stuff like Benadryl or hydrocortisone creams, but without a vet's approval, these are highly, highly risky. Their safety and the right dosage depend heavily on your dog's specific breed, their weight, age, medical history, the whole shebang.
And that brings us to what I consider the absolute golden rule of pet safety. Always consult your veterinarian before giving your dog any medication intended for humans. Just guessing a dosage or assuming a human anti-itch cream is safe can literally turn a minor, localized sting into a serious medical complication. So when in doubt, keep that human medicine cabinet closed.
Moving right along to Section 3, recognizing veterinary emergencies.
So the really crucial point we need to talk about here is anaphylaxis. This is a severe allergic reaction, and it can progress incredibly rapidly. We are talking about symptoms popping up within mere minutes of a bite or a sting. This is basically your ultimate speed bump in this explainer. If you even suspect anaphylaxis, you stop monitoring at home right then and there, and you get straight to an emergency clinic. To make sure you know exactly what that looks like, let's contrast a mild reaction with an actual emergency. So a mild reaction features general discomfort, swelling that's just right there at the site of the bite, and local itchiness. It's annoying for sure, but it's stable. Anaphylaxis, on the other hand, brings severe red flags. You need to watch for systemic collapse or profound weakness, sudden vomiting or diarrhea, seizures, and excessive panting or wheezing. If your dog exhibits any of those severe signs, please do not wait around to see if it improves. Seek emergency veterinary care immediately. Now, beyond full-blown anaphylaxis, there are 3 specific scenarios that should totally bypass at-home monitoring and warrant an immediate professional evaluation. First up, if your dog has never been stung before. Since you just don't know how they're going to react, having a vet there can help monitor and identify any complications early on. Second, if your dog already has a history of allergic reactions, because they are at a much, much greater risk of experiencing another severe one. And third, suspected spider bites. Some spider bites are highly dangerous to dogs and require very specific medical treatment, especially if you start seeing unusual swelling developing.
Okay, let's take a breath and move to Section 4, Preventing Future Insect Encounters. Now, obviously, we can't eliminate every single bug from the great outdoors. That's impossible. But working through a proactive checklist, that massively reduces your dog's risk. Take a little time to inspect your yard regularly for bee or wasp nests that might be hidden in the eaves or the bushes. Try to keep your dogs away from areas with heavy insect activity. Keep a close eye on their outdoor playtime during peak bug seasons. And always use veterinarian-approved parasite prevention products. So, to kind of wrap up our explainer today, most insect bites and stings really are just minor inconveniences. They heal up with a little bit of time, maybe a cool compress, and some basic supportive care. But by knowing the distinct signs of a mild reaction versus an anaphylactic emergency, you are now perfectly equipped to act quickly and correctly when it actually matters most. Ultimately, just a little extra caution ensures your dog's outdoor adventures remain safe, fun, and totally itch-free. Which leaves me with this final, kind of provocative thought for you to chew on. Are you and your pet first aid kit actually ready for your dog's next outdoor adventure? When this explainer ends, I want you to go check your supplies. Do you have a rigid card ready for stinger scraping? Do you have that pet-safe aloe vera on hand? Is your vet's emergency number already programmed into your phone? Take action and get prepared today. That way, the next time your dog meets a bug, you won't miss a beat. Thanks so much for joining me, and hey, here's to many more happy, healthy days outside with your best friend.